Okay, so this patient, Hannah, is David Guthrow. He's a 22-year-old male. He has type 2 diabetes. He was admitted 1 week ago. He came in with weakness, uncontrolled blood sugar. His glucose on arrival was 31.2. Having some difficulty at home with his meds and his diet.
Okay.
His vitals when he came in were 36.5, 96 pulse. Rests were 28, and his blood pressure was 149/82 with his SATs of 97.
Okay.
He was anxious when he came in, past medical history of hypertension, GERD, diabetes. He has a diabetic foot ulcer on his right foot,
Okay.
some ETOH issues, and he does smoke 1.5 packs a day.
Okay. Thank you. Mr. Guthrow, how are you?
How are you today?
Good. My name's Hannah. I'm going to be your nurse today.
Nice to
Just
meet
going to
you.
do a blood sugar check. But
Okay.
first, can you tell me your name and date of birth?
My name is Michael Guthrow,
Mm-hmm.
and my birthday July 20th, 1997.
Perfect. Thank you very much. So I'm just going to clean your finger. Now I'm going to prick it, okay? Mr. Guthrow, your blood sugar is 31.4.
Is that high?
It is. Can I ask when's the last time you ate something?
Well, I had a few snacks this morning.
Okay, and what kind of snacks did you have?
Well, I had 3 chicken nuggets from last night. The missus brought them in.
Okay.
Jessa brought me in a slice of pizza, so I had that too.
And did you eat everything else on the table?
Yeah, but I don't like those, so I never had those. But I had the bar, yeah, and I had iced coffee. But yeah, I didn't think I ate that much.
Okay.
Yeah.
Nurse Hannah is at the nurse's station.
All right, Mr. Guthrow, you really know that you should not be eating all this stuff with your diabetes. Look at the sugar content in this. There's way too much sugar. You really should not be eating this. And those chicken nuggets, I know they probably tasted really good, but you really can't eat that kind of stuff. It's just going to increase your blood sugar. You're going to have more problems with your foot.
But I can't stop. I love eating it.
All right, Mr. Guthrow, you explained to me that you ate all these snacks here. Can you explain to me, maybe why you felt like you needed to eat this much?
Stress, maybe.
Stress,
Yeah.
yeah? Are you feeling really stressed out?
Yeah, it's a stressful place to be, the hospital. It's just,
Right. And when you're not in the hospital, typically how do you think you deal with your stress?
Well, I like having a couple of drinks.
Couple of drinks, yeah? You can't have those here.
No, so I eat lots of food. I like to drink coffee.
Okay.
The coffee's not the greatest here, so my girlfriend gets me some coffee.
Is there anything in the past little while that might have increased your stress levels?
Well, I lost my job 4 months ago.
Lost your job, okay. How would you feel about meeting with a dietitian or a social worker?
Do I have to pay for that, or?
No, they'll come to you right here at your bedside in the hospital.
Okay, that's good.
That's good? Okay, I'll make an appointment for you, okay?
Thank you.
You're welcome. Hi, how are you today?
Good, how are you?
Good. Are you Mr. Guthrow's nurse today?
I am.
You are, okay. How was he doing this morning?
His sugar is not doing too good. It's 31.4.
Oh. Good. Yeah, this seems to be a pattern. Like, his blood sugars are staying high.
Yeah.
So I think what I'm going to do is I'm going to put him on some Humulin R, 4 units sub-Q at noon,
Okay.
and Humulin N, 10 units sub-Q at noon. So I'm just going to write this order for you, and we'll get that into him. It's pretty shortly.
Perfect.
Okay?
you.
Thanks so much.
Thanks. I'm just going to double check the doctor's orders for Mr. Guthrow's insulin. And I'm going to drop the cloudy and then the clear. For 14 units. Can you double check this?
14, yeah.
Okay. Double checking Mr. Guthrow's doctor's orders for his insulin. Okay, I'm going to drop 4 units of Humulin R and 10 units of Humulin N. I'm going to go administer to my patient. So I checked the doctor's orders for Mr. Guthrow's insulin, and I drew up 4 units of clear and 10 units of cloudy, and I'm just going to get the nurse to double check. Could you double check Mr. Guthrow's insulin?
Sure. So that's 14 units. 4 of Humulin R and 10 of Humulin N. Is that right?
Yes.
Great.
Perfect. So we are going to administer that to Mr. Guthrow. Hi, Mr. Guthrow. How are you today?
Good yourself?
I'm good. Can I have your name and date of birth, please?
David Michael Guthrow, July 20th, 1997.
Hi David, how are you today?
Good yourself?
Good, I'm Danielle. I'm your nurse today. I just came to do your dressing on your foot. Is that all right?
I'll be back in 20 minutes, so I need to go for a cigarette.
You know what, David? You really should stay here while I have time to do this dressing, and you shouldn't be smoking anyway.
But I'm croaking.
I know, but you know, you're in a hospital. Okay, that's no problem, David. I'll be back in 20 minutes. Okay. Well, you know what, David? I know you want to go outside and have a cigarette, but the doctor did order you some nicotine replacement patches, and we can put one of those on if you want instead of going out for a cigarette today.
I'll try it.
Yeah. Okay, that sounds good. I'll go get some, okay? And then we'll get your dressing changed. Good afternoon, Mr. Guthrow. How are you?
Good yourself?
Good. I'm Hannah. I'm going to do your dressing change.
Yes.
Can I confirm your name and date of birth?
David Michael Guthrow, July 20th, 1997.
Perfect. All right. Let's see what we got here. I'm going to start taking off the bandage. Oh, is it sore?
Yes, it's
Really sore? Okay. Hang tight there. Okay, so it's a little greener than yesterday, and it kind of has an odor. Was it like that?
No, it's...
No, that's new?
That's new.
Okay.
Nurse Hannah is back at the nursing station. She's charting her findings on Mr. Guthrow's wound, and we'll continue to monitor.
Mr. Guthrow, I'm just going to do this swab here. I'm sure there's an infection. I'm supposed to have an order to do this anyway, but I'm just going to do it. Oh, sorry if that hurts there. All right, okay, thanks. Hello, Dr. Poirier? Hi, I'm just calling about patient David Guthrow here. I just did his dressing change on his right foot there for his foot ulcer. Yeah, there's a lot more exudate today than there was yesterday. There was also a foul odor, and the patient found it a lot more painful. Would you like me to do a culture and sensitivity for that? Okay, so I do have an order to do that. Okay, perfect. I'll send that off here shortly. Thank you. Hi, David. I'll be your nurse today. I'm Heather.
Hello, David.
Hey. You said you had something to tell me?
Yeah, it's kind of embarrassing. I haven't been taking my metformin for the last month and a half. That's why everything's been out of whack.
Okay, why haven't you been taking your metformin?
Well, I lost my job 4 months ago. I just can't seem to make ends meet.
Oh, okay, so you're having trouble affording it.
Yes.
Okay. Well, thank you for telling me that, David. Since I know you're going home, I can probably give you a week's supply of our stock supply of metformin. That'll at least get you started, okay?
Really, for free?
Yeah, just don't tell anyone, okay? And just try to better afford your medications going forward. Okay, David. I think the metformin tablet is only about 10 cents. It's not a very expensive medication. And I did see in your history that you smoke and you do drink a couple beer a week. So if you manage your resources a little better, it should be really easy for you to afford your metformin. So I don't really understand that excuse. I just want to let you know that there are ways that we can help you afford your medications.
Oh, really?
So I'm just going to chart what you had told me, let your doctor know, and we could probably get a social worker involved who can help you to afford your medications, okay?
That'd be great.
Okay.
Thank you.
Thanks.